Mahahawa ka ng HIV kapag nakipag-share ka ng pagkain o niyakap ka. Mga bakla lang yung dapat nagpapatest sa HIV. Mamamatay ka agad pag nagkaroon ka ng HIV. Wala na magmamahal sa'yo kapag may HIV ka. Ngayon pa lamang sasabihin ko na sa inyo that these are false. Tutuldukan natin ang mga maling impormasyon at maling akala tungkol sa HIV. Period. I'm Joseph Moro, and here's what you need to know. Based on the latest reports from the Department of Health ngayong taon, the Philippines recorded 55 new cases of HIV per day. Sa ulat din ng DOH 2023, nasa 418% ang itinaas ng kaso ng HIV sa bansa bawat taon mula 2010 hanggang 2022. Ilan sa mga dahilan kung bakit tumataas ang kaso ng HIV ay ang takot magpa-test, stigma, kakulangan ng edukasyon at mga maling impormasyon tungkol dito. Sa episode na ito, itama natin ang mga maling akala tungkol sa HIV. Myth, parehas lang ang HIV at AIDS.
HIV stands for Human Immunodeficiency Virus. And how does it affect the body? Special siya as a virus, no? Kasi ang katawan natin, whenever we are infected with a disease or other infections, gumagana ang ating immune system para kalabanin ang mga infections na to, no? HIV is unique dahil pinapatay niya mismo ang mga sundalo ng katawan natin, ang immune system natin, no? So most people or all people who are infected with HIV, inevitably, hindi sila namamatay or nagkakasakit dahil sa HIV mismo. Namamatay or nakakasakit sila dahil wala na silang sundalo sa katawan nila. So ang AIDS ay ang pinaka-advanced na stage ng HIV infection. And nangyayari siya kung ang HIV ay tuluyan ng nasira or napatay ang immune system ng isang tao.
During the early days of the HIV and AIDS epidemic in the 1980s, isa sa pinakatinamaan ang gay community. Maraming pasyente ang hindi nakakatanggap ng tamang tulong at paggamot para sa HIV dahil sa mga isyu ng kahirapan, racism, gender inequality at homophobia. More than 40 years later, unfortunately, the stigma stays. Myth, only gay men should get tested for HIV.
Anybody who wants to can get checked for HIV. Anybody who has sexual encounters is advised to get tested for HIV. Ang HIV ay hindi namimili ng tao, hindi siya namimili ng gender, age, sexuality. Basta lahat ng tao na exposed to risky behaviors, risky sexual behaviors, or IV drug use ay pwedeng magkaroon ng HIV.
Myth, mamamatay ka na kapag nag-positive ka sa HIV. Ang totoo, despite what others may tell you, hindi na dapat kinakatakutan ng HIV dahil this is not a death sentence anymore. Sa kasalukuyan, wala pang lunas sa HIV. But with early detection, ibig sabihin mas maagang malalaman, at ikalawa, early treatment or medication, mas maagang gamutan, people living with HIV can have a normal life like many others.
Sa ngayon, wala pang cure ng HIV. Hindi pa namin kayang tanggalin ang HIV sa katawan mo. However, kaya namin siyang i-manage. So, ang mga gamot for HIV ngayon ay tinatawag na antiretroviral medications. At ang ginagawa namin ay pinapatulog na lang namin yung virus para hindi ka na niya masaktan. Pinapatulog na lang namin ang virus para wala na siyang negative effects sa katawan mo.
Myth, HIV can be transmitted through casual contact such as hugging, kissing, or sharing of food.
Hindi talaga. HIV is only transferred through infected blood or other bodily fluids. So, hindi kasali doon ang laway.
Myth, if you have sex with someone living with HIV, you will automatically get HIV. If a person living with HIV reaches yung undetectable na status, ang ibig sabihin niyan, hindi na siya nakakahawa.
HIV now is very easy to manage. Hindi na siya katulad ng dati. Nowadays, you just have to drink one pill every day to suppress nga yung HIV sa katawan mo until you reach an undetectable status. PL-HIV individuals once they've achieved an undetectable status, they are untransmissible.
Sasabihin din ng iba, edi huwag ka na lang makipag-sex para hindi ka mag-HIV. But we all know that's not for everyone. Pero, there are ways to practice safe sex to prevent HIV.
First, of course, is if you are monogamous with your partner, or if you do not have sexual contact, if you avoid IV drug use or recreational drug use. But of course, we know that that's not for everyone. Some people are very sexually active. So doctors also highly encourage the use of protection such as condoms in order to facilitate safe sex. But still, even that, it's been a long time. Doctors have been trying to encourage people to use condoms for a very long time. Sometimes it's difficult. Some condoms are not for everyone. So it's good that nowadays we have other means of preventing HIV, such as pre-exposure prophylaxis or PrEP and post-exposure prophylaxis or PEP. So those are avenues to prevent HIV.
Myth: mahal ang PrEP at condoms kaya mas tipid kung wag na lang gumamit ito kapag nakikipag-sex. PrEP and condoms are largely free at available ito sa ilang government at non-government facilities.
Ang condoms at lubes at ang PrEP ay libre. They just visit loveyourself.ph. Papadala namin kayo ng test kit para malaman nyo muna yung status nyo. And then, pag nalaman nyo na yung status nyo, pwede na kami magpadala sa inyo at magpa-schedule kayo ng appointment para sa consultation para sa inyong free pre-exposure prophylaxis. Libre ito.
Myth: you can tell if someone has HIV by just looking at them.
And a big reason why sometimes it's difficult to catch, especially when people don't get tested, is because until it gets very bad, it's asymptomatic. There's a long period of time where people don't feel anything at all.
So ano yung mga sintomas ng HIV na pwede nyong makita?
Ang pinakaunang mararamdaman ng tao ay ang tinatawag namin na acute retroviral syndrome, no? So, nangyayari lang yon in about like 4 to 6 weeks after ang exposure to HIV. At ang nararamdaman ng isang tao ay parang malalang trangkaso or a very bad flu. Pwede silang magka-fever, pwedeng sumakit yung kasukasuhan nila, hindi sila makaakyat sa kama nila. Tapos minsan or madalas namamaga ang kanilang mga lymph nodes, no? Pero nawawala yon ng mag-isa. Kaya most of the time, ang mga tao ay hindi man lang nila napapansin na yun na pala yun, no? Then, sa gitna nun, people can go for a very long time na wala silang nararamdaman, wala silang kahit anong simptomas. Until ang katawan nila at ang HIV ay naglalaban.
Kaya kailangan magamot agad yung HIV para hindi na ito tumuloy sa AIDS.
Kung hindi sila ginamot, inevitably mananalo ang HIV at pagkapasok na nila sa AIDS, no? Ang nararamdaman una ng mga tao na nandito na sa late stage or advanced stage HIV ay mga sakit na hindi nawawala. Pwede siyang ubo or sipon na hindi nawawala, pagkahirap ng pagkahinga. Usually na lumalabas din ang mga skin manifestations or sa balat na lumalabas. So hindi na nagki-clear yung skin nila, nagiging oily, madaming mga pimples or other lesions. So yon ang usual na unang nararamdaman ng isang tao na papasok na sa advanced HIV or acquired immunodeficiency syndrome.
Hindi ibig sabihin na kapag may mga ganyan ka ng sintomas, automatically may HIV o AIDS ka na. The best way and the only way para malaman mo is to have yourself tested. Myth: wala nang mamahal sa'yo kapag may HIV ka.
Having HIV does not make you unlovable. Many people with HIV have fulfilling relationships and families. So, stigma and discrimination, eto yung number 1 na kalaban natin. Kasi ang daming misinformation. So, it's very important that you, our viewers, make sure that you have the right support, education, loving, healthy relationship na possible sa people living in HIV sa pamamagitan na making sure na alam nyo yung mga tamang information.
And the report by UN AIDS, still possible to reach the end of AIDS by year 2030. Yan ay siyempre kung pagtutulungan yan ng komunidad at ng mga serbisyong medikal para sa mga may kailangan nito. According to UNAIDS, there are 39 million people living with HIV globally in 2022. But out of the 39 million, 9.2 million do not have access to life-saving treatment. 630,000 have died of AIDS-related illnesses in the same period.
How does somebody improve their lives with HIV? I always tell my patients something very important at sinasabi ko sa kanila, pagkalabas mo ng clinic na to, ito dapat ang panghawakan mo. HIV is just a disease. It doesn't define your life, okay? You live your life as best as you can. Kasi sakit lang naman to. It's the same for people with hypertension or diabetes. You do not let the disease define your entire life. So, madami akong mga PL-HIV patients who do anything they want. They have fulfilling careers, they have fulfilling relationships, they're very active in sports or activities or in their careers. So, HIV is just a disease. Don't let it define you.
So kami sa Love Yourself, we have a motto na tinatawag naming choosing kindness. So, ang masasabi ko, number 1, education is key. Seek information from reliable sources and health professionals. Kasi ang daming lumalabas sa social media, yung iba hindi totoo.
Remember, understanding and compassion are the greatest tools in fighting HIV. Hindi yung panghusga at diskriminasyon. Period.